So now we will move on to the lower body treatment and evaluation. First thing I want to do to make sure that the patient is safe to work on without injuring her is I will do a gentle range of motion test to see how sensitive the nerve and the joint is. So here I'm checking the hip flexors and lateral rotators. I find there a little bit of resistance and a nerve compression from the piriformis and sciatic to the inside. I'm being very careful not to force the stretch, but just see where the joint moves naturally and where its end feel is. The end feel is where the tendon reaches its maximum stretch and then refuses to go any further. So we see here we have the hamstring is in spasm right now, as well as the piriformis around the sciatic is a little entrapped. Also, we have from the adductor magnus a limitation there. So I will gently check the hamstring. Okay, definitely sensitive, but not so inflamed or sensitive that it's unsafe to work on. So I will now proceed to work on the iliotibial band first and vastus lateralis in order to relieve the tension from this main tendon, which is very dominant, especially because on the L4, L5 herniation, the hernia protruded to the left side, compressing the transverse nerve as it's coming out down the outside of the leg and sciatic. So I've been monitoring this on her and making sure that every time when I come in here, I check this tendon, and this tendon is my main gauge in her progress. Today, I feel it's much stronger, as well as a little less tight than it's been the last 13 sessions. So I know that is making progress. Again, when I'm working, I want to make sure I position the leg in a nice aligned with the hip and with the foot before I work on it, so that I have a positive anatomical stimulation on that leg. I don't want it to be in any other position when I'm working on it than the position that I see is best aligned with the joints. Now I will move on to the peroneus, which is very interesting for her. When she first came in, this was one of the most sensitive points besides the pain in her back. And as you can still see, it's very sensitive there because it went into spasm when the L4 herniated. This is another one of my indicators on her progress, is this pressure point right there on the peroneal and on the tibial anterior right there. Now, she had a secondary injury due to all the stress from the herniation, and when she was stretching, which was not advised, but she felt like stretching, and she actually popped a part of the hamstring, the lateral head of the bicep femoris. It wasn't a complete tear, but just a partial tear, and that often happens when you're dealing with herniated discs, is that after the disc is herniated, there's all kinds of secondary injuries coming because the spine is unstable, and when people are walking around and going about their daily activities, they often have other injuries that result. So she actually ended up tearing a little bit of that hamstring, and then afterwards her symptoms got worse again. She had a relapse and was left with numbness along the peroneal nerve here, which she has lost a little bit of sensitivity here. Now, I'm very pleased because as we've been working, that numbness has gone away, and slowly the feeling is coming back. Originally when it happened, her toes actually went completely numb, but now she is starting to regain feeling in there, so I am not I'm not so worried about that anymore. Now those kind of symptoms, when you see them, those are big red flashing lights. You gotta be aware of that and make sure that the person recovers or gets proper help, because there might be spinal impingement, which we know that there was. Now Liz is a candidate for open back surgery. That's what the neurosurgeons recommended, but she made the choice that she wanted to try natural medicine first and exhaust that before she went to surgery. And so we are here working on it, and so far so good, because she is making very good progress for this kind of an injury. So now I will move on to work on the Achilles. Again, I make sure that I have the body in a nice, aligned, anatomically correct position before I start working on it. Achilles is very sensitive today and has been.